Hi, this is Brittany Hutchinson, registered nurse for Alina Home Care Services. I just completed an initial home visit with a 78-year-old male who is receiving continued care for the treatment of COPD. He's receiving oxygen 2 liters per nasal cannula to keep his oxygen saturation above 92%. He also has active diagnoses of anxiety, hypertension, hyperlipidemia, and obesity. His home medications include the remaining course of oral antibiotic amoxicillin and lisinopril, omeprazole, acetaminophen, lorazepam, potassium, finasteride, and salmeterol fluticasone inhaled puff. The patient was recently hospitalized for an acute exacerbation of COPD related to acute bilateral pneumonia. He was discharged from the hospital yesterday and is now staying at home. The patient continues to have an unsteady gait and is anxious about falling. He is unsteady on his feet and becomes tired quickly with activity. He states that he is easily winded. He also states that he removes his oxygen to access the bathroom because the tubing will not reach and for mobilizing through some of the hallways. His O2 saturation was 93% upon assessment, and upon auscultation, he had decreased lung sounds in the lower lobes. The patient was missing his prescription order for ipratropium via nebulizer. He said that when he went to the pharmacy, they told him that he did not have an order for it. And he said that he also had a lot of difficulty organizing his medications. So my recommendations, wondering if we can get a doctor order for a portable oxygen tank and a walker for his unsteady gait so that the insurance can acknowledge the order and cover the cost. Also asking for clarification in the patient's discharge medication ipratropium. We'd like to get a PT-OT consult for strengthening and gait and to complete a thorough home safety assessment. And it'd be nice to get a consult for a nutritionist to address his decreased appetite and a need for a low-fat diet. I recommend activity orders to ambulate frequently and respiratory orders to cough and deep breathe regularly and use the incentive spirometer. Thank you.